Hello, doctor. This is Megan. The WHO said in January and actually tweeted that China found no evidence of human-to-human transmission of COVID-19. And then yesterday, President Trump doubled down on that in his briefing, criticizing them for their handling of this. And then he announced he is stopping funding. Do you think that the WHO mishandled this?
You know, in the beginning of every pandemic, and I've lived through several now, and I take us back to where the HIV/AIDS pandemic, we didn't know how it was transmitted. We didn't know who was infected. We didn't have a test. Everybody was trying to do the best they could. And I think very early on in pandemics, you have to increase your level of reporting and transparency. Because it's a new disease, every word and every experience that you have becomes very critical for the global public. I think once this is over, we'll be able to look back and see, did China and the WHO say and do everything to alert the rest of the world to the nuances of this virus? Because when it first explodes, someone had to have known that there was human-to-human transmission. You know, I see how this has moved through the United States, and I can see how you can go from 1 or 2 cases to hundreds of cases and a high doubling rate, which we call, you know, the R0, and R0 values that some people predict could be 4 to 6. That's not subtle. And so you really have to go back and ask yourself, why wasn't there this level of transparency when this virus exploded? I think people would have prepared differently if they had known the level of transmissibility of this virus.